Lincolnshire Health and Care has created an initiative called Care Portal, which will provide better ways of delivering essential health and social care services in the county. Currently, health and care services are not working together as effectively as they could. And with a growing and ageing population, the current approach will not be sustainable in the long run. Lincolnshire Health and Care will provide residents with access to safe and good quality services closer to home and avoid, where possible, a lengthy hospital stay. Mrs. Jackson is 78, suffers from the lung disease COPD and diabetes, and lives alone. She regularly has appointments with her GP and visits from her community nurse. She also attends outpatient appointments for her two conditions. During a routine visit, her community nurse suggests that Mrs. Jackson would benefit from a referral to her local neighbourhood team. As part of this discussion, the nurse explains about the Care Portal and asks Mrs. Jackson if she would give permission so that she can see her wider health and care records. Mrs. Jackson agrees, and the nurse sees that Mrs. Jackson has a number of regular interventions and appointments, and that the neighbourhood team could support Mrs. Jackson to manage her own care at home. Mrs. Jackson is given telehealth devices, which allow her to monitor her own oxygen levels and blood sugar levels. She is now more in control of her own condition, and the community nurse does not have to visit so regularly to take readings, but can monitor her well-being remotely. The community nurse receives an automated warning via email when Mrs. Jackson's oxygen levels are dropping, and is able to click straight through to Mrs. Jackson's record via the Care Portal to view the full warning and details of Mrs. Jackson's readings. She visits and finds that Mrs. Jackson has not been using her inhalers properly. She reviews Mrs. Jackson's treatment, and this prevents a trip to hospital. At the same visit, Mrs. Jackson mentions she has recently had an assessment for dementia, but is not sure of the outcome or what happens next. The nurse checks on the portal and is able to get the contact details of the mental health nurse and call her up to agree next steps in Mrs. Jackson's care, which she can then explain to Mrs. Jackson. A few months later, while out shopping, Mrs. Jackson trips on the pavement and hits her head. She is unconscious and is taken to hospital in an ambulance. The consultant has to break the glass to view Mrs. Jackson's patient history. This tells her that Mrs. Jackson has COPD, which has a critical bearing on the amount of oxygen she should be given. It also shows the medication she is on and her diabetes. This means that nurses know they have to check her blood sugars while she is in hospital. A short while later, Mrs. Jackson has a visit from a social worker to see how she is managing with some home adaptations fitted while she was in hospital. Mrs. Jackson says she is coping well at home, but she is now nervous about going out. The social worker opens up the community directory of services on the Care Portal and looks at what is on offer locally, which might enable Mrs. Jackson to remain active. She is put in touch with a COPD group, which enables her to get out and about and spend time with other people who share her condition.